Good evening, everybody. We're just going to wait for some people to join before we start. So maybe we'll give it a few moments and then we'll be back to you. Hello, everyone. It's nice to have you already chatting with us through the comment section. Keep it coming. Hello, Allah. Hello, Khadija. Again, we're just waiting for a couple people to join before we start so that everybody can benefit. So we'll give it 3 more moments, 3 more minutes, and then we're going to get going. Hello, everybody. Hello, Ahmed. Hello, Muhanna. Hello, Isra. Hello, Asad. All right. Seems like we're enough to start. I think other people can follow through as they join. Welcome everybody to this webinar. This is our second webinar of the Youth Online Learning Opportunity Series. We're going to discuss things you can do and actions you can take to improve your employment chances internationally as a refugee or displaced person. This project is done in partnership with Chiron and is funded by Hopes Lebanon. So thank you everybody for joining us. This session will be held in English, and this is the case for upcoming sessions as well. We will have Arabic translation later on after this session is done and posted. But for now, it's going to be in English. So thank you everybody who joined us today. This session is to help healthcare professionals who are interested in international employment opportunities. As you might know, our healthcare program in the UK is seeking nurses, midwives, and other occupations that we're going to mention later. Many of our candidates have already made it to the UK and started either training or working in many hospitals. So today we're going to talk through some of the points and some of the things you can do to improve your profile and to potentially increase your chances of securing an opportunity. With us today is David Fitzgerald, who is our project manager. He's going to talk to you about the program itself, what you can do to improve your chances. And without further ado, we're going to put David on the screen. David, welcome and thank you so much for being with us today. Please feel free to introduce yourself, and you can start sharing your slides whenever you need to.
Yeah, perfect. So, thanks for the introduction. So my name's David and I am the healthcare lead here in the UK. So I oversee all of our healthcare projects with Talent Beyond Boundaries. And yeah, so the purpose of today is I will just give you some tips on how you can help yourself stand out in your CV and some kind of preparation that you can start to do for your interviews, or hopefully potential interviews anyway. So let me just start sharing my slides. Perfect. So hopefully you can all see that. Okay, brilliant. So in terms of the introduction around the healthcare program in the UK, so we are doing a lot of work at the moment with various different healthcare providers here in the UK. So the UK healthcare system has two aspects to it. You have the National Health Service, or the NHS, which is available to everyone here in the UK, and it's basically free care at the point of treatment. And you also have the private healthcare sector as well, where patients or individuals can choose to pay for their care themselves, and they go to private hospitals to do that. In terms of who can be considered for the roles that we're recruiting for at the moment, so we are obviously focusing on those displaced individuals to come and be part of the projects that we're working on. We're looking for a wide range of healthcare workers, so nurses. We are also looking for some allied health professionals, so radiographers, physios, occupational therapists, mammographers, kind of whole range. In the future, hopefully, we will be looking to help more medical professionals, so doctors. But at the moment, it is mainly kind of focused on the nursing and allied health professionals. In terms of some of the partners that we work with, so we have done a lot of work with the NHS, so as I say, the National Health Service. The NHS is actually the biggest employer in the UK across the whole country. We also work with an organisation called HCA Healthcare, and they are a private hospital group. And we are continuing to expand with other private hospital groups, and we are also doing a project at the moment with the Home Office, the UK Home Office, which is also with the NHS as well. Cool. So in terms of we're looking for experience wise in the UK, so obviously the question that you should be able to see on the screen at the moment is, should I have a certain academic background to work in healthcare positions? So the short answer is no, you don't need a specific academic background. As long as you have got the required educational qualifications to work as a nurse in your current country, then that is acceptable pretty much. And as long as you can register as a nurse or a healthcare worker, so an allied health professional in your country, then that is absolutely fine. It is more about your experience that is the bigger aspect as around than a certain type of qualification. So typically your qualifications will be degrees, and as long as that's kind of transferable and you can register in your own country, then that is absolutely fine. You'll be able to register here in the UK. In terms of transferable skills and what you should look at in the context of healthcare, so as I kind of touched on already, the real big thing here in the UK is your experience. So what have you learned? What have you enjoyed? Where do you see your career going? So really focus on what you've done so far and what specialism really you've looked at and you've worked in, or if it's a particular area that you want to work in, then obviously, look up and read up on things like that, so that you can kind of bring that up in an interview and show your interest in a particular area. As I mentioned, if you don't have experience, so say you're a newly qualified healthcare individual, then focus on what areas you have enjoyed whilst doing your clinical placements. So for an example, a UK hospital will look at what specialty you can fit into when you arrive here in the UK. So if you've worked in as a nurse in cardiac ITU, for example, then make that really clear when explaining your experience on your CV. So, you can literally just put ITU nurse, cardiac specialism, something like that, but make it really bold and clear as to what your current experience is at the moment and what other areas you've worked in. If you've always worked in ITU, then that's great. You'd focus on that. Or if you have worked in theatres, for example, if you're an operating room professional, then I would focus on what area within the operating room you worked on. So if you did scrub or recovery or anaesthetics, or you did all of those, really make it clear that that's what you've done and that's where your experience lies as well. In terms of tech skills that you should focus on or try to develop on, really, you should think about what kind of equipment you use on a daily basis. So again, if we take a nurse in a cardiac ITU as an example again, then think about what type of ventilators you've used, or if there's a specific type of catheter that you've used in your hospital, those kind of things. One thing that it is really important to remember is that hospitals across the world, use completely different equipment sometimes. And just, so you might be really familiar with equipment in your hospital, but that doesn't necessarily mean that that equipment is used here in the UK. So that's not a negative thing at all. It's just that, that's the equipment that you've used and that's where you've gained your experience. If you are successful in a position here in the UK, then you will be offered training to use any equipment we use here. So so I wouldn't worry too much about that. But in terms of your transferable technical skills, that's really what you should kind of be looking at, focusing on. What transferable interpersonal skills should you develop? So as I'm sure it is in a lot of places in the world, there's a really big focus on teamwork within healthcare, and in particular within nursing. So you should really look at how you work in a team, but also how you like to be communicated with within a team. So if you understand and have a knowledge of how you like to be communicated with best, then obviously that gives you the opportunity to kind of influence that in a working environment for yourself. So do you if you think of it in context of if you're given a task to do or you're given some information, do you like to go away and reflect on that information that you've been given before you act on it? And if that's the case, then obviously that's a great thing to communicate to your wider team so that they can understand how you like to work a little bit better. And ultimately all of those things will help build and develop on a great communication and great teamwork. So that would be my bit of advice there, is to think about how you like to be communicated with, or how you work at the moment and how you're communicated with at the moment, so you can really kind of develop an understanding of the best ways to communicate within a team. How can you improve your CV when you're applying for in healthcare? So as already touched on, the most important thing is your experience. So I think a lot of times when you're thinking of a CV, you perhaps think about putting all of your job description down, and all the things that you've done in your day-to-day job. A lot of those things are expected of a nurse, so you don't need to put down exactly what you've done in your day-to-day role, but remember to go back to the experience that you've got. So be short and concise in your experience, and make sure that it's clear what you've done. Okay, so what experience you've gained. And I think it's important to remember as well that the people that are reviewing your CVs here in the UK, it's very likely that they are a clinical member of team. So as I'm sure you can appreciate, they have very busy days, as you would yourself. So it's to remember that they've taken the time out of their day to review your CV. So they want to be able to see straight away from looking at your CV what it is you've done, and what area you've gained your experience in. So just a few key points. So job titles, place of work, and your employment dates are clear, and focus on what you've done and be clear about all of your specialisms. So like I said before, the best kind of example would be to put nurse ITU at X hospital, and then you've worked there from this date to this date. So just make it really clear, and then just give a few brief bullet points underneath around what you've done in your day-to-day job. But like I say, just focus on the most important aspects. You don't need to have your daily ins and outs of your daily duties. it's also kind of best practice as well that if you've got a gap in your employment, to put that down and explain why you were out of work at that time for whatever reason that might be. It just makes it easier for them to understand a little bit about yourself and why you might have had 2 months out of employment or whatnot. But just make sure that's documented and a little brief explanation of why that is. I would recommend that you list your relevant qualifications in a separate section. Normally at the end of your CV is best. And then make sure that obviously the number one thing you want to include in that is your degree or your qualification that enables you to do the job that you do. And then anything else you might think is important. So if you've done any specific courses that you think would be really relevant to your job, then obviously include that as well. Quite often you might feel like you want to include things like any life support training that you might have done in your job. I would recommend to probably not put that on, just because those kind of trainings are standard trainings here in the UK. So you will be getting them regardless. You would always be doing those, and those would be kept up to date for you. But if you've done any specific kind of management training, or if you have been trained to use a specific piece of equipment, that kind of stuff, those are the things you want to focus on. And then the kind of real big thing as well is to try and keep your CV to no more than 2 pages. Obviously, if you've got quite a long career history, then you might need to go a little bit more than that. But I think 2 pages is the maximum that you should be aiming for in your CV. Now we're going to kind of move to some information around interview and interview structure here in the UK for healthcare positions. So there isn't really a set structure for clinical interviews, but most clinical interviews will follow a mix of competency-based clinical questions and questions around how you work as a team. Okay, but the main thing that they will want to understand from an interview is what kind of experience you've got, and ultimately how you put that experience into practice. So they might give you a scenario. So, say you come on shift and a patient's unresponsive, what would you do? Those are the kind of types of questions that ask. So really prepare on your clinical knowledge and also how you feel that you've worked as a team as well. In terms of how you should practice for your interview, I'll go through this with you now. So this is a method that I think is great for preparing for an interview. So it's called the STAR method, and it's a really good tool to help you navigate how to answer your questions and to give your answers to your questions some structure. Okay, it also gives you the opportunity to take a little bit of time to think about how you want to answer your question, and gives you a little bit of focus around staying on track when you're answering your question as well. So STAR, so it stands for situation, task, action, and result. So situation is where you want to introduce the situation and set the scene to provide some context to it. The task is describing the task, what was needed to be done and why. The action is explaining the action you took, and the result, again, describe the result of the actions taken. Okay, so it's really worthwhile to think about some examples before your interview, but follow that process as well. If you feel like it might be useful to have those initials written down on a little bit of paper or anything like that, then feel free to do so. Sorry, I got back one slide. And in terms of examples and preparing yourself for an interview, I would always really recommend thinking about 1 or 2 examples of a situation that you can apply to multiple answers, really. So if you think of a situation where maybe you've had to deal with a difficult team member, how did that work? How did it go? How did you resolve things? So in that instance, using the STAR method to answer, you would introduce the situation. So say, for example, you came on shift and one of your colleagues was late, and it meant that handovers were delayed and things like that. You provide the situation and give some information to provide a context to it. Describe what the task is. So what did you need to do in that situation and why? And then the action. So what did you do in that situation to help resolve it effectively? And again, focus on the you in that situation. So you want to make it clear what actions and what steps you took in order to resolve the situation. It's quite easy to say we because you want to show teamwork, and sometimes that's great, but also you want to show that you have got some confidence in the situation as well. And then finally are the result. So what happened from the action that you took? How did that resolve the situation? You could even go into how you felt about that situation at the end, and how you felt other team members felt, and if you had a discussion about the situation. A whole range of kind of different aspects you can focus on there. But as I said, think of a couple of examples that you can apply to different methods. So it also means as well, don't be afraid to use an example more than once if it's pertinent to the question. So if you think it applies to more than one question, then use that example again. That's absolutely fine. And then also, I think my big thing for an interview, my biggest tip is don't be afraid to ask for more time to think, or for the interviewer to rephrase the question if you don't understand it. And also, if you genuinely can't think of your response at that point, just say to the interviewer, I'm really sorry, just, I can't quite think of anything at this point in time. Would it be okay if we move on to the next question and come back to it? So it buys yourself some time to think of the answer. And it also shows a little bit of confidence in yourself as well, and that you really want to take the time to answer the question properly. That's it from me in terms of interview tips and whatnot. So I think we will go over to Q&A. I think I'm probably a little bit faster than I anticipated, so apologies.
Well, that's a good thing. It leaves us with more time for questions because we received plenty in the comments. So maybe we can get started with them. I just want to remind everybody that if you have any question, just post it in the comments and we'll answer you live, as long as the question is related to what we're talking about, of course. So remember 2 days ago, we asked you in a post to prepare any questions you have for David. So many of you left some really interesting questions and comments. So we just prepared them together and we're going to share them now. Just note that some of them were in Arabic, so they had to be translated. But nonetheless, let's go through them. The first question is from John Scott. Is it necessary to have graduated with a nursing degree? Because I only received training from an institution.
It depends on the training that you have got. So if that training enables you to be kind of recognised as a practicing nurse in your country, then that should be fine. But it is on a case-by-case basis. So typically it would be a degree that you would have in order to register as a nurse here in the UK. But if you're not sure, I would recommend either going online and reading yourself, or if you apply to TBB, we can have a look at what qualifications you've got and then advise you on if that would be something that your training would be transferable to the UK.
Thank you, David. Our next question is from Abu Ibrahim. He's asking, I am a nurse, but you haven't contacted me after I improved my English. What should I do? Maybe I'll handle this one. So we offer you resources to improve your English because the English is a requirement for many roles. However, this varies from candidate to another. Some people have enough time to improve their English, let's say in 2 months. Others take more than that, depending on their initial level as well. So if you feel like you are ready to do another intake with us, please reach out to us either by email or through Facebook and let us know that you think you're ready. So maybe you can do another assessment with you. David, do you want to add anything?
No, I would completely agree with that. I think if you feel that your English is improved and that you'd like another opportunity, then let us know and reach out and take some initiative to reach out to us, and we can review your experience and your English level again.
Definitely. And now we have another English related question, which is why is there an English requirement in place? Why can I just relocate and then learn English?
Great question, actually. So basically, a lot of it is to do with your visa. So in order to relocate to the UK, you need to be sponsored, and you need to have what is called a tier 2 visa. And the government put some requirements in place for that, in order for you to be eligible to be sponsored on that visa, basically. And one of those requirements is your English language. So you need a minimum level of English in order to meet the requirements of that visa. You also need to have a minimal level of English in order to register with the NMC, which is the Nursing and Midwifery Council here in the UK. And ultimately, you will be working in English, so you need to have a level of understanding, and in order to do your training, that is all done in English as well. So yeah, it's a government requirement, and unfortunately there's not any kind of workaround to that, I'm afraid.
Definitely. Well, now we have a question about opportunities from Wasim. I don't see many opportunities for people with a background in pharmacy. Can we expect some in the future?
Yes, you absolutely can. So you're absolutely right. At the moment, we don't have many opportunities for those with a pharmacy background or a pharmacist background. But that is something that we are looking to develop here in the UK. And we do have some interest from some employers around pharmacists and other pharmacy roles, so pharmacy technician roles, for example. But we're in the very early stages of that. So yeah, in the future, I would say early next year, we should have some opportunities that you should see online for those types of roles.
Well, this is great news. Our next question is from Ahmad, who's asking, is having a good IELTS score a prerequisite to apply?
It's not a prerequisite to apply, but it obviously helps. So the further that you are along with your English language, the better. And there are different options to look at. So if you're registering as a nurse in the UK, for example, there is other options to the IELTS. So you have the OET, which is the Occupational English Test, and that is nursing focused. So you might feel that you perform a little bit better in that. But yeah, you can apply, and we can advise you on what kind of level of English you have at the moment and what you might need to improve on. But ultimately, you will need to be at a certain level in order to apply. So in order to get here, sorry. So I would weigh up whether you think you're at that level, or if you're at level 5 or above, I would say apply, because we can kind of help you with some resources to get you to a little bit higher.
Definitely. I also want to add that while having good English, a good command of English, like David mentioned, it certainly helps you to submit a TC profile and to register with GBB. You don't have to have a result already. And if you come to a stage where you need the test to travel and you have the English, but you just, for many reasons, like you couldn't afford the fee or you didn't know how to register, we will help you to register for the test, and we might help with covering the fees as well. So you don't need it to apply to TBB, but to get to the UK or get an employment contract, like David said, you definitely need it. Our next question comes from Sarah, who's asking, is the OET or CBD exam, must it be done before traveling to the UK? And I think it's a similar answer.
Yeah, it is a similar answer. So it depends on the opportunity. So some of our employers are happy for you to do some aspects of that when you get to the UK, but you do have a limited amount of time to do that when you get here in the UK. I would recommend doing as much as possible that you can before you come to the UK. But again, speak to us, apply and find out what opportunities we've got, and we can advise on what exams you will need to sit in order to qualify for those opportunities. But there is the option to do it in the UK, but as I say, it depends on the employer.
Great. Okay, so we have a question from our Facebook live feed from Iman, who's asking, what is the exam that must be done in the UK to be officially registered as a nurse?
So there's a few parts to it. So the first part is your English language assessment, so either your OET or your IELTS. The second part is the CBT, so it's a competency-based test, which you do online, and it's like a multiple choice question. You would then submit all of your documents to the Nursing and Midwifery Council. They would check everything over and confirm that you meet the criteria. And you would then be eligible to sit an exam which is called the OSCE, which is like a situational exam. So there's a number of stations, and you would go to a station and they would ask you to complete a task. Once you've passed that exam, you would then be eligible to be to join the Nursing and Midwifery register.
Great to know.
I would just say as well, if anyone wants more information on that, then if they have a look at the Nursing and Midwifery Council website, it's an NMC website, if you just Google it, they give you a lot more info on what you can expect.
Thank you, David. Well, now we have a question from Allah, who's asking, as a medical doctor, what should I do to increase my chances to be contracted?
So it's all about the opportunity here in the destination country, ultimately. So I can see that you've applied to TBB, and we haven't got an opportunity for you yet, which I understand can be frustrating. But it's not a medical doctor positions are not something that we have many of at the moment. And it's what we are looking into and what we hope to develop into. So what I would recommend is to carry on improving your English as much as possible. Just keep practicing, keep doing things like that. Have a look online to see what requirements you need to register with the GMC, which is the General Medical Council, which is who you register with for doctors, and kind of start prepping on that, and ultimately keep looking out for opportunities that we advertise for those types of roles here at TBB.
All right, thank you, David. We have a question from Ashraf, who's asking, what is the difference between the NHS and HCA in case of the acceptance criteria?
So I assume that you're kind of referring to what exams and things you might need to have done before coming to the UK. So they're both very similar, actually. So a lot of them will take it on a case-by-case basis. So if you have got your CBT and your IELTS, then that is all the better. If you haven't yet got that, say you've only got your CBT, but you haven't done your English language, then they might accept that. HCA, for example, like people to have their CBT, but will let them do their English language here in the UK. And some NHS trusts need you to have CBT and your English language, and some will accept a mix, and then again some will let you come and do your CBT and your OET or IELTS here. Yeah, it's a very vague answer, I'm afraid, but it does completely depend on the different opportunities. But ultimately, they're all pretty much the same in terms of criteria.
Good to know. We have a question from Hanan, and I think I'll take this one. Are there any other opportunities in the humanitarian field, or is it restricted to the health domain? We received variations of this question. There is a surge in health in opportunities in the healthcare sector right now, especially in the UK, but that doesn't mean that we only work with with the healthcare industry at TBB. Like we have all sorts of opportunities going on at the moment. It's just that there is a current surge thanks to our partnership with the NHS in the UK, and that's why you're seeing a lot of materials and advertisement going on about this. But we don't like exclusively work with nurses. That is not the case. Whatever your occupation is, as long as you're a refugee or a displaced person, we are happy to help you in any way that we can.
Yeah.
All right, moving on. Just looking through your comments. Okay, a question about papers and certificates. I did not complete nursing in Syria because of the war, and I don't have any documents to prove that. So I'm assuming the question is, am I still eligible? Can I get an opportunity?
It's a difficult one, to be honest, because you do need to prove to the Nursing and Midwifery Council here in the UK that you have trained as a nurse. So unfortunately, if you don't have any documentation to show that, you would find it difficult to get an opportunity here in the UK. That's not to say that there might be other opportunities for you. So we potentially have some opportunities becoming available for what we call healthcare assistants. So they are like nursing auxiliaries. So you could potentially meet the requirements for those types of roles, but for a nursing position, you would need your documentation, unfortunately, in order to secure a position.
Yeah. I would also like to add that in case you have missing documents, we might potentially be able to help you through our team of lawyers. We might help you to retrieve some of your documents, but this is still a big if. It may be possible. So if you get to a stage where you need these documents for a certain exam or qualification and you can't retrieve them, we might be able to help you with that. But then, like David said, it makes it a little bit more difficult. But nonetheless, we'll do our best to support you. Now we have a question from Mohammed about the timeline. It's a bit of a long question, so I'm gonna just skim through the last parts, which say, I want to ask if there are any specific period to get back to me because most of my friends have received a job offer. So David, could you please touch down on what makes getting back to candidates take some time, like how the process works from an employer perspective?
Yeah, absolutely. So basically, obviously what will happen is the TBB team will reach out to you to tell you about the opportunities that we've got, if you meet the criteria for those opportunities, and have discussions with you, etc. We will then put your CVs forward to the employer, and the employer will then decide who they want to interview. So unfortunately, sometimes it might be the case that they don't necessarily have the right experience, or you don't have the right experience that the employer is looking for, or there's just some other CVs that stood out to them a little bit more. If that's the case, then you should get feedback on that from the employer through TBB, and yeah, so the employer would select those that they want to interview. The employer can take a couple of weeks sometimes to come back on CVs on who they want to interview, and then it might take another few weeks before the interviews take place, and then it might be another few weeks after that until you get the feedback. So if it's a specific role, if you've interviewed for the role, contact one of the team. If you're waiting for the right opportunity to come through, then it's probably just that we don't have anything at the moment that fits your experience criteria. But yeah, reach out to the team and ask the question, really. And like I say, if you've interviewed, it might just be that we're waiting for feedback from the employer, or if your CV is being submitted, we might not yet have the feedback to give you.
Certainly. I don't have anything to add to that. If you have any kind of wanting to inquire about your status after doing an interview, please reach out to us. and we'll do our best to get back to you. But like David said, most of the time it's just we're waiting for feedback. We have a question about potential opportunities for people in the mental health field. Do you have any project for workers in the mental health field, like psychologists and disability?
Yeah, so we do have some opportunities at the moment for mental health and nursing here in the UK. So if you feel like you fit the bill for that, then there's definitely opportunities for that. Opportunities for psychologists, they would fall more under our kind of medical doctor opportunities. And like I said, at the moment, we don't have many opportunities for that. It's something that we're working towards, but we don't have anything at the moment. But yeah, if you think you might fit the bill for the mental health nursing side of things, then yeah, we definitely do have those kind of opportunities at the moment.
Okay, great to know. I'm just looking through the comments again. Okay, we have a question from Dado. If we can't pay the expenses of exams, how can you help us?
So we can help. So if there's certain exams that you need to take in order to be registered, again, depending on the opportunity, some of our employers will offer to pay for those exams for you, and we can help facilitate that. Or if the employer is not offering to pay for the exams, TBB can potentially help you. So I don't ever be put off by not having the money to sit the exams. Don't let that put you off applying, because there is workarounds and there's options available to you as well. But let us know, reach out to us, let us know what issues you're facing, and we can help you from there.
All right, we have a question from Ibrahim who's asking, please could you elaborate more on what happens after we receive feedback on the first interview?
So basically, after you've received feedback, hopefully it will be good feedback to say that you are being offered a job position. If that's the case, we would then talk you through the next steps, which would typically be you would receive an offer letter. You would then need to do pre-employment checks with the employer. And then depending on what their requirements are, you might need to do your CBT or your English language, etc. I can see as well that you've asked about, does it entail more than one interview? Again, that depends on the employer. So some employers might want you to do 2 interviews. Some might only do 1 interview with you as well. Typically at the moment, it is a 1-stage interview for most of the opportunities that we have available. And if you are not successful at interview, then we will give you feedback as to why you weren't successful. You know, if it's that they thought that you didn't answer your questions quite as well as you could have, and then obviously if that's the case, we can give you some tips and coaching on how to improve on that for your next opportunity as well.
That's great to know. We have a question from Marwa who's asking, I would like to know if there are any opportunities for lab technicians, which is a question we received from other comments as well. So do you have any idea about lab technicians?
So lab technicians, potentially there might be the opportunity in the future. At the moment, a lab technician doesn't really fall under the category to enable you to be sponsored to work in the UK. So the way that the visa works and the sponsorship opportunities are normally aligned to roles that there are a shortage of those staff in the UK. So like nursing and doctors and things like that. Whereas in that particular position, there isn't really a shortage of candidates in the UK. So at the moment, we don't really have those opportunities, and I wouldn't envision that we'd get many of those opportunities in the future either, unfortunately.
All right. Now we have a question from Mahmoud who's asking about opportunities for fresh graduates. Do you have anything to say about that?
Yeah, so there's no, yeah, so sorry, I was just reading your question again. So, you know, which is better, nurses with experience or nurses freshly graduated? I know I sound like a broken record, but again, it is dependent on the opportunity from the employer. So a lot more employers are open to newly graduated nurses, because it gives them the opportunity to kind of develop you and mold you into how to work in that hospital setting. Yeah, so it does completely depend. For example, some of our private hospitals, they do want you to have experience, whereas the NHS might consider you with no experience. So again, apply, register your interest with TBB, and we can advise you on what opportunities are available for your experience or skill set.
All right. Now we have a couple of questions from candidates asking about their specific occupation. Like, for example, from Ala, who's asking, I'm a gastroenterologist. Are there any opportunities for me? I think this answer would be the same for everybody, but like, would you like to elaborate on it, David?
Yeah, so a gastroenterologist, so again, you would fall under our medical doctor field. So no, not right now, but yes, there will be some opportunities for you in the future. It's what we're working on, and you should see some of those opportunities come through hopefully early next year. Yeah, so just keep your eye out, and hopefully as we get them through, you'll see those advertised.
All right. We're receiving some questions and comments that I would like to clarify. So, for example, we have some comments from people asking us about scholarships and education. I just like to clarify that we're not an educational institution. We cannot help you if you would like to continue your education, unfortunately. What we do is we match you, if you are a refugee or displaced person, with employment opportunities in one of our destination countries. Today's the focus a little bit on the UK, but we have operations in Canada, Australia as well. But we cannot help you if you would like to continue your education. Also, another question that we touched base on, which is, are job offers only for the medical domain? The question is no. We enclose all domains. Whatever your occupation is, you can register with TBB. That doesn't guarantee that we'll be able to match you with an opportunity, but we'll do our best. But the purpose of this webinar is to address people in the healthcare sector and medical professionals. So that's why the discussion is revolving around this. Let's check the comments again. We have a general question about general practitioners. I think I pressed on the wrong comment. The question was asking about including general practitioners. I'm not sure what that means in the medical domain, but David, do you have an idea?
Yeah, so general practitioners would be, again, doctors. So that is an opportunity that we would look to explore early next year, and hopefully we will have some opportunities come through for GPs. Yeah.
All right. Looking through your comments again. If you have any questions, please do post them in the comments. We have a question related to the TAN catalog. I can't log into my profile. What should I do? If you have any problems, just please reach out to us on Facebook. We'll help you with regaining access to your profile. So don't worry about that. We have a question from Khadija, who's asking, is it possible for my file to be nominated and for the English level to be average? I know it's a bit of a subjective question, so and I know you probably touched base on this before, David, but could you please address Khadija?
Yeah, so it depends. So obviously, when we do part of your intake into TBB and into the talent catalogue, then we'll assess, what kind of level of English you have at that point. As mentioned before, you do need to kind of meet a minimum requirement. So we would be looking at very minimum of like an IELTS level 5, in order to really be able to put you forward for opportunities, because we would want you to feel confident in an interview as well, to to be able to communicate and answer the questions effectively. So if for whatever reason we're not putting you forward for an opportunity due to your English, ultimately it's because we don't. We want you to perform as best as you can and be as confident as you can in an interview. So, yeah, it does. Like we said before, it doesn't stop you registering with TBB on the talent catalogue. Like, still register, and we can assess and see where you are. Yeah, I hope that kind of answers your question.
And I think you mentioned something important, which is the TBB process, which is something I think it's useful to elaborate on a little bit more. When we conduct an initial interview with you as TBB, we kind of get an idea about your English level. And if you don't have a conversational level in English, that would be problematic, because then you wouldn't be able to sit through the interview. And then even if you made it through the interview, getting the visa, like we just mentioned, is going to be difficult. So there's the practical side of going through the interview and signing documents, and there's the legal side. So it's not a requirement that we set in place to make your life harder. On the contrary, we're trying to do everything we can to make it easier for you. However, admittedly, there is an advantage to people who actually speak better English, because you need to go through interviews, you need to sign documents, you need to showcase the employer that you are capable of working in that environment, that challenging environment, especially in healthcare. So if you feel like you would need to improve your English, we can provide you with resources and online courses to do so. But making it to a new country is going to be difficult if you don't speak enough English, because again, we're not a resettlement organization. We don't work on migration. We help you to move based on your skills and ability to work, not on the basis of your humanitarian status. Although we take it into consideration, but it's not the basis on which you move. So that is why the English requirement is in place. Looking through your comments again. This is new. What about medical social workers? Do you have an idea, David?
So again, yeah, we will hopefully have opportunities for social workers coming up. That's something that we're looking into at the moment. At present, we're trying to understand if you are able to register in the UK, if your qualifications will transfer properly, and if you are able to register. So again, there's potential there, but it would be next year we'd be able to kind of give a bit more context to that, and if we are able to, then hopefully we should have opportunities next year.
Exactly. And I would like to add that, as you can tell, and as David mentioned, we're expecting another surge in opportunities in so many different domains starting next year. So if you're hesitant about having an opportunity at the moment, even if we don't have it now, we might have something for you in the future. Mm-hmm. So feel free to register, and we encourage you to do so, because that's going to help us find you faster. And please encourage your family and friends who are also interested in this, because then we'd be able to find you sooner and connect you to the employer who might be the employer who's going to hire you. Okay, we have an English question. So basically, the question is saying you're not very good with conversational English. And again, we can provide you with resources to improve that and training to do that. So please reach out to us and we'll provide you with that.
Yeah.
All right. I think we've covered everything. Just going through the comments one more time. All right, I think we've covered everything. I'm just gonna give another minute for anyone who has a question. Again, this webinar was targeted at healthcare professionals and people in the healthcare field. So if you have any questions for us, please do share them. We would like to remind you that we also have active opportunities in healthcare and other fields, but since this is about healthcare, we'd like to remind you that we're actively looking for midwives at the moment. And again, of course, the main thing is that you speak English, because we have some very bright candidates, but unfortunately they couldn't meet the English requirement, so they're doing their training now. So if you are a midwife, or if you know someone who is, please refer them. We're also looking for mammographers and nurses who've worked in cardiology. So please also make sure to apply, or tell your friends who might fit this criteria. You can find all these in our previous posts, and you can view the job description and the requirements. We're seeing a comment who is a midwife. Please do register. I'm going to share the website with you. The website is tbbtalent.org. Feel free to fill a profile, and if you are fit, we'll get in touch with you. Another vague question is about exams. I'm not sure if you mean English exams, but if that's the question, unfortunately, David, I'm going to ask you to repeat yourself one more time.
Yeah, so it depends on the opportunity, but what I would recommend is that if you can do the exam in Lebanon, so whether that's your English exam, or if you're a nurse, your CBT exam, it will only help you in the long run to kind of secure an opportunity more quickly. If you need help and support in sitting your exam financially, or from resources, register with us, reach out to us, let us know. And we can advise you on what opportunities there are and what those requirements are, and then provide you with any support that you might need as well.
All right. Another question that's been repeated, so I'll take it off your shoulders. If you hold a bachelor in a medical laboratory, this depends on the opportunity. So some opportunities might allow you to work in a certain field if you have that kind of degree. So it really depends, but as long as you registered with us, we will do our best to find you and get in touch with you. And of course, David, if you'd like to add anything, feel free to do so.
No, you completely covered that. Yeah, as the name says, if register, if we've got something for you, hopefully we will in the future, then yeah, we'll contact you.
All right. I think this covers it. We have one last concern from Berpyong. Why didn't we reach out to you again? I'd like to clarify, if we've conducted an intake with you before and we didn't get in touch with you again, it could be because you don't have the English level that's required, and therefore we would have already sent you resources for you to improve your English. Otherwise, we could be waiting for feedback from an employer, and that's why. In all cases, if you think it's helpful, please reach out to us on Facebook, and we'll be able to support you by checking your profile and letting you know if there's any update. But if there's any update, I would say always get in touch with you. So don't worry about that. I'd just like to remind everybody, if you would like to register to be considered for international employment, visit tbbtalent.org. To register your skills, and like David mentioned, please add all the relevant details that could help us identify you, which means don't add I'm a nurse, add your specialty as a nurse, add where you've worked, add as many details as possible. If you have any questions about registration, please reach out to us on Facebook, Or if you need to reach out to us by email, the email is info@talentbeyondboundaries.org. I think this is it for us today. David, thank you so much for being with us today. I'm sure everybody benefited, including me. So now I can answer some questions about healthcare. So thank you so much for your time. Really enjoyed having you with us. And thank you for everything you do to help our candidates move and use their skills to move to secure futures. Thank you, everybody who joined us today. And we'll speak to you soon in another webinar. Have a great night, everybody.
Right.